Hi, in this video let's discuss the next set of questions starting with Kennedy's class 4. We have a classification for partial edentulous areas, class 1 to class 6. So Kennedy's class 4, as you can see in the image, it's a single bilateral edentulous area located anterior to remaining natural teeth, and this crosses midline as evident in the image, isn't it? Now moving on to the next topic, pepsinogen activation. So pepsinogen, it's an inactive form. It's converted into pepsin, which is an active form. It's a proteolytic enzyme, and this activation happens in presence of hydrochloric acid at an optimal pH of less than 6. So gastric juice acts mainly on proteins, and it contains proteolytic enzymes like pepsin and renin, RENNIN. And along with these enzymes, there are some other enzymes in gastric juice which include gastric lipase, gelatinase, urease, and gastric amylase. Pepsin is secreted as inactive pepsinogen. Pepsinogen is converted into pepsin by hydrochloric acid. Optimal pH for activation of pepsinogen is below 6. Now moving on to the next topic, myxedema features. So hypothyroidism in adults causes myxedema. In children it is cretinism, isn't it? So myxedema features include, as you can see in the image, characterized by bagginess under eyes, puffiness of face, slowness in physical and mental activities. In fact, we have been discussing the same myxedema features in one of the recent study club discussions. Now moving on to the next topic, humectant in dentifrice. So as the word itself indicates, something which retains moisture, humectant, humidity. So humectants retain moisture so that dentifrice doesn't dry out. Humectants function by binding and holding the solvent in the dentifrice. Water is a solvent used in most of the dentifrices. Humectants include glycerin, sorbitol, which also inhibit bacterial growth and provide flowability to dentifrice. Humectants and solvent combined represent approximately 75% of a typical dentifrice formulation, right? Now moving on to the next one, Wilson's disease. In fact, we have a case report pertaining to this in our textbook. We'll just go through that case study and then we'll go through the lab characteristics of Wilson's disease. The schoolboy aged 12 years complains of abdominal pain and was admitted in a hospital. He was weak and tired and had a history of behavioral disturbance and epileptic form of seizures. Clinical examination revealed that the boy had an enlarged liver. His cornea showed presence of Kaiser-Fisher rings characteristic, and the laboratory data of the boy is given below. Serum copper, it's 40 micrograms per deciliter. Serum ceruloplasmin, it is 5 milligrams per deciliter. Urinary copper, it's 200 micrograms per deciliter. And also you can see in the table the reference ranges, so which clearly suggests that the boy had a low level of copper and ceruloplasmin in serum with an elevated copper excretion in urine. The clinical manifestations and the biochemical data indicate that the boy was suffering from Wilson's disease. This disorder is associated with deposition of copper in liver, kidney, as well as in brain. Right? So these are some of the lab characteristics or lab data pertaining to Wilson's disease. Now, moving on to the next topic. Often we have confusion pertaining to this X-linked dominant or recessive mode of transmission. So we'll briefly discuss about X-linked dominant inheritance with one example. You had a question on father transmits the disease to all of his daughters. So what is the type of inheritance? If you look into the image now, see, X-linked dominant inheritance, also called as X-linked dominance, it's a mode of genetic inheritance by which a dominant gene is carried on X chromosome, hence it's called as X-linked dominant. So in case of X-linked dominant inheritance, we have different combinations. First, we'll go through the question which was asked in the recent exam. When the father alone is a carrier of a defective gene associated with a disease or disorder, he too will have the disorder. His children will inherit the disorder as follows. Pertaining to his daughters, 100% of his daughters will have the disorder, since all of his daughters will receive one copy of his single X chromosome. This is X-linked dominant, isn't it? And pertaining to his sons, none will have the disorder. Sons do not receive an X chromosome from their father, which means if you look into the question, father transmits the disease to all his daughters, it's a clear-cut case of X-linked dominant mode of inheritance. If it is autosomal dominant, 50% of offspring will have the disease or disorder. If it is autosomal recessive, 25% of the offspring will have the disease or disorder, right? So in this case, when the father is having this disease, then there is 100% chance that his daughters will have the disease, provided it's an X-linked dominant disease or disorder, right? Now, what if mother is also a carrier? What could be the consequences? So if mother is a carrier of mutated or defective gene associated with a disease or disorder, she herself will have the disorder. Her children will inherit the disorder as follows. Daughters and sons, 50% will have the disorder, 50% will be unaffected. Children of either sex have an even chance of receiving either of their mother's 2 X chromosomes, one of which contains a defective gene in question, right? If both parents were carriers of defective gene, right, then 100% of their daughters will have the disorder, since all the daughters will receive a copy of their father's X chromosome, and 50% of their sons will receive the disorder and 50% remain unaffected. Sons have an equal chance of receiving either of their mother's X chromosomes. So just look into the flow chart, it will be much more clear for you, and you need to put this on paper. We'll anyways elaborate on the same in separate sessions, right? So in a case where both parents carry this defective gene, X-linked dominant disorder, the chance of daughter receiving 2 copies of X chromosome with defective gene is 50%, since daughters receive 1 copy of X chromosome from both parents. If this were to occur, X-linked dominant disorder, the daughter would have a severe form of the disease manifestation, right? So these are various combinations pertaining to X-linked dominant mode of inheritance. So just observe the flow charts, the pedigree. It will be much more clear for you. Anyways, we'll discuss in detail about these different modes of inheritance in the coming days, right? Now, moving on to the next topic, sibilant sounds. So, in fact, we have discussed in detail about various sounds in our E-classes. We'll just have a summary. So, sibilant sounds, labioalveolar or labiodental sounds. So, we have different kinds of sounds. Bilabial sounds, B, P and M. Labiodental sounds, F and V. Linguodental sounds, TH. Linguoalveolar sounds, T, D, S, Z, V and L. And also we have linguopalatal linguoalveolar sounds like ear, she, and we have velar sounds, K, G and KG, right? So we have different kinds of sounds, and in order to have these sounds we need a specific arrangement of teeth, not just teeth but also the surrounding soft tissues, isn't it? So let me know what the question was pertaining to these sounds. I will try to elaborate in the description part of this video, because as such this topic is so huge, it will not be sufficient for us to cover in this short duration, right? Now moving on to the next topic, disinfectants. Which of the following is not used as disinfectant? I guess hypochlorite is there in one of the options. So sodium hypochlorite on skin or eyes causes redness and pain. After prolonged exposure, skin becomes more sensitive, hence it's not usually used as a disinfectant on skin, right? So which of the following is not used as disinfectant for skin preparation? Hypochlorite, alcohol, hexidine. So hypochlorite would be more appropriate answer. Now moving on to the final topic, Petraeus Rosy. Petraeus means scales, rosy means pink or rose colored appearance. So we have herald spots in clinical appearance. We'll go through the literature now. Petraeus Rosy is a common benign papillosquamous disease causing acute skin eruptions of unknown etiology. It denotes Petraeus. The term Petraeus denotes fine scales, and rosy implies rose colored or pink color. It can have a number of clinical manifestations, and its diagnosis is important because it may resemble secondary syphilis. If you look into the clinical features, the disease is more common in hot, dry climatic countries like Australia, Malaysia and India. Petraeus Rosy is more common in women than in men and commonly develops in children and young adults, although any age group can be affected. It's characterized by appearance of superficial, light red macules or papules, either generalized over most of the skin surface, with usual exception of face and hands, or localized to certain areas such as trunk, thighs, axilla or groin. This generalized outbreak is frequently preceded by appearance of a primary lesion or herald spot 7 to 10 days previously. This spot is brighter red and larger, 3 to 4 centimeters in diameter, than multiple eruptions which follow its appearance. The individual exanthematous lesions are commonly ovoid with long axis parallel to natural lines of cleavage of skin and are covered by thin silvery scales. So this is a clinical presentation of Petraeus Rosy. So we have silvery scales, we have rose pink appearance and herald spots which manifest 7 to 10 days prior to the generalized clinical features. So these are some of the topics which I wanted to highlight in this video. I hope it's clear, right? And as I said, we'll elaborate on these modes of inheritance in coming days. We'll have separate videos on the same and we'll post them in our e-classes for your benefit. I hope it's clear.